Well, hi everyone, it's Peter here from the Pain Toolkit, and welcome to Q&A for the 1st of June 2025. And I'm good with my good buddies who are joining us on this Q&A session. Keith Meldrum, good morning to you, Keith.
Morning, gentlemen. Good afternoon, I mean. Mhm. Mhm.
Keith's over there, is over there in Kelowna in British Columbia, and Dave Oxley is over there in a really nice county in the UK called Buckinghamshire. So, welcome to
Good
the
morning.
good afternoon to you, Dave. Listen, had some questions come through this week from healthcare professionals asking really some really good questions actually um, about how they can help support patients or people like us really a little bit better, and let's jump into the first one, shall we?
Yeah.
So, from John, he says he wants to know a bit more about pain education. And he asked, what are the most effective ways to educate patients about self-management skills, and how can we encourage patients to take an active role in their management? So, anybody want to start that one off, or do you want me to jump in?
I'll jump in first. I just got a couple of thoughts. That's a really good question. And I think the first thing, in my opinion, that has to happen is that people like me, and maybe you guys were the same, you first have to get to a point in your life where you're ready and willing to look at doing things to help yourself. And I say that only because for so many years, for me and for so many people that I've talked to, I was chasing down a solution solely through the medical system. You know, I just thought if they did the right needle intervention or the right procedure or waved the magic wand or whatever it is, that the healthcare system would just make all this pain go away. And I think part of that, um, I remember when I was 12 years old, I broke my collarbone falling off my bike, and I broke my collarbone and it hurt and it healed and I got better and the pain went away. So after I had my car accident and I got hurt in a much bigger way, I thought, well, the injury got better last time and went away. How come it didn't happen this time? So I thought they just didn't try hard enough. So it took me a long time to realize that all the things that I was doing to try and make this pain go away weren't helping. And in fact, I was actually probably making things worse. And it wasn't until somebody kind of not very, in a very haphazard way, kind of introduced the first self-management concept to me, just kind of threw it at me, which I dismissed the first time, which was about relaxation breathing, because I thought it was just a bunch of bunk and voodoo but I finally tried it after a while because nothing else was working, and that's when I realized, hey, there are things that I can do to help myself. So what I needed, and I think what a lot of people need, is first to come to that place where they say, I am, I do have some control over this, as much as it feels like you don't, and there are things that I can do to help myself, which then leads into really the fundamental part of that question is what is the best way to help people learn that. And first, I think we need healthcare providers who understand the importance of supportive self-management. And when they realize that they've done all that they can do in their world, they can stop focusing on being the fixer, and they can now move to being that supporter with the person, and they can help them move into self-management.
Mm. For me, I think the most effective ways, first off, I always say to ask people, how do they learn? Because people learn in different ways. Like so, I say, how do you learn? Do you learn from watching things, or do you learn from reading, hearing, or perhaps a combination of all, or doing, or combination of all those three or four, So, because then, as we are as coaches, it's being a self-management coach. It's about being prepared, having the right materials ready for how people learn really. Like it's no good. I mean, back in the day, like for me, it was always oh, here's a leaflet. But I've never been. I can read, but I've never been a learner from reading. I'm a watcher, and it seems most people with long-term pain and even long-term conditions, with more visual, we learn from visual ways. So. So that's probably the most effective way, really, is asking how they learn, and then about putting a package together, etc. And the second part of your question, it says about how do we encourage patients to take a more active role. And you've got to remember, John, that a lot of people patients that you see um, when you're in your career is that um, many of us have been anchored into the medical model of ways, like, and so we're used to being told, well, this is what you need to be doing, sort of thing, really. And it's more about having a partnership, way of working, and just about getting people involved, like, asking them, well, what things have you stopped doing, but more importantly, what do you want to get back to doing that stuff, or do you want to start learning some new skills, like, some simple stuff, like, etc. But really, it's about, as you probably heard me say before, it's getting people back on track, back in the driving seat, because at the end of the day, it's a as it was for me, it was me getting back on track and then back in my driving seat, so that I'm driving driving a vehicle, sort of thing, so that so I know where I'm going, etc. Like, but as I say, for a lot of people, we're anchored into that medical model where we're waiting for something to happen, being done to us. Go here, do this, go that. And it's about us becoming more. Thinkers, like, So, have you got anything to add to that, Dave?
Yeah, I think one of the key things is being open and honest with the patient to tell them that, this is the end of the medical model, as it were. There's nothing else that they know about at the time that will be able to take that pain away magically through drugs or procedures or whatever, and work with the patient to come to accept that the medical model's not going to solve it at the moment. It may in the future, who knows? But at the moment, the medical models sort of reached the end of the road. So, now let's change the way we approach this. And one of the things that scared me when I was going through this was when I started to try and do stuff outside of, the pure medical model of injections, manipulations, whatever, was something hurting again.
Mm,
So, trying to get the person to understand that there's nothing more you can do from injection, drugs, etc. And then, right, let's treat it in a different way. You're going to start to take more control of this. However, you've been avoiding doing all these nice things that Pete was talking about, and it's going to hurt possibly when you start doing it. You think if you don't live in pain and you go for a run and you haven't run for 6 months, you're going to wake up the next morning and your thighs are going to be absolutely killing you. So it's the same for somebody that's been living in pain, because we've been spending all of our time avoiding making triggering the pain. So our muscles have atrophied and other things, and we've just not got used to moving. So, it's going to be a slow journey, but you are going to see the benefits over time.
mm. Thanks, Dave.
Yeah.
Anything to add, Keith, or should we move on
No,
to the next?
I think we move on. That was
Okay.
awesome. Mhm.
This is quite an interesting one from Harry. I'm guessing he's from America because Harry's using physical therapist. So I'm guessing did he have physical therapist in Canada, Keith, or is it physiotherapy?
We call them the same thing as UK. We call them physiotherapists.
Physio, okay.
Yeah.
And Harry's saying he wants to ask questions about interdisciplinary approaches. How can different healthcare professionals collaborate to support effective pain management? And what role do physical therapists, psychologists, and pharmacists play in a comprehensive pain management plan? Okay, so it's an interesting one. I love this. I love this question, really, because I tell you what, I was out when I was out in New Zealand pre-COVID. I bumped into every time I think of his name, name escapes me, but I know on Twitter he's known as Naked Physiotherapist. No, say his name escapes me at the moment, but yeah, it happens when I'm getting older. And he was saying how he works closely with he's a physiotherapist, and but he works closely with OTs, like,
Mhm.
and I think that. and I look back to the pain management program that I was on, and there was a mixture of healthcare professionals there. So there was the pain doctor, there was a clinical psychologist, physiotherapist, occupational therapist, and I think a pain nurse as well. And but they all worked together as a team, like, and that, for me, that was because that pretty much covered all bases, really, of because we're us lot people living with pain, etc. We have just not we have multiple situations going on, like, it's about emotional stuff going on and whatnot. So I think really it is important that there is an interdisciplinary approach to pain management, but you don't really see that quite often. It's sort of, you may see perhaps one, or you'll see one, but possibly two. But I don't think in most situations you may not get that approach unless you go to a pain management program. And and I think physical therapists, as you say, psychologists and pharmacists. I remember, 'cause if you think back, when people do get a pain, when it may be an acute stage or even a long-term stage, a high street pharmacist will be their first port of call. And I know they did some research a few years ago. It's funny enough, I come across it only this week, of some pharmacists up in North London, where they train them up to be like pain self-management coaches. And apparently, the outcomes from that training, etc., was fantastic because they was able to do a lot of medicine review, but at the same time, they was able to give the patients that came into the pharmacy some self-management advice, etc. Like, I'm not sure, I can't remember if there was a course involved. So I think healthcare professionals, from all other disciplines, they've got a part to play, as are like us guys, really. Where I suppose they would say us as lay coaches. We haven't got medical degrees or anything like that, but we become lay people in self-management. We've learned the skills, and now we're passing them on to other people. It's like in the with the Paint Toolkit Academy, we've got myself and Dave, and also Katie Napton, who's a physical therapist, a physiotherapist, and I think she's brought a lot of expertise into the courses that we offer. I don't think I think it was just me and Dave doing it. I don't think it would have worked. It may have worked out, but I think Katie's brought in. But Keith, what's your view on it?
Well, I mean, the gold standard, I think, is multidisciplinary care. And like you said, Pete, same thing here in Canada. You don't often see that unless somebody is in a clinic where that clinic's model is interdisciplinary care. And the reason is just as you said. I mean, people's pain is sort of their complete totality of their lives. So it's everything, from management of pain, and sometimes medications are an appropriate part, short term, long term, as needed. But it runs the gamut of the biomedical, the psychological, the emotional, social, spiritual, movement. And when you have a team that is communicating, and the physiotherapists, and understanding that physiotherapists back in the day, and probably still today, were a lot like doctors, where they're like, well, if I can't fix your pain, then nobody can. When they realize that their role is to play a part in it, help you find ways to move and strengthen parts of your body in a way that are safe, so you're not going to hurt yourself. You layer that in with your OT that helps you find ways to get through your day better, how to arrange your life so that it's easier for you. You have a psychologist who can be there to help you on those days when it's all like overwhelming, or like all of those things. That is sort of this wraparound care that best supports people to be able to move forward. And that's not to say that you will need all of those people for the rest of your life. You may go in and out, and at different times have different aspects of them. But foundationally, when you're given all of that support, it sets people up for success, as compared to being, just as you said earlier, Dave, when the medical system says there's nothing more I can do for you, all too often what you're given is there's nothing more I can do for you, full stop. Instead of there's nothing more I can do for you as a physician, but here is this group of people who can help you live the best life we can. So, but they have to be all on the same page. They have to understand that pain is a complete, total human experience. It's both the sensation of pain and the experience of pain and all that goes with it. And to be able to work together, set their egos aside and say the most important thing is the person in front of them, it's the team.
Yeah. Anything you add, Dave?
No, you two have covered that one beautifully. Thank you.
Okay. Okay, the next one is they don't give a name. Challenges and implementation. What barriers do patients typically face when trying to adopt self-management techniques, and how can we help overcome them? How can we tailor pain management programs to meet the diverse needs of individual patients? I tell you, these questions are really good today that have been sent in. But who wants to answer that one?
How about you go first, Dave?
Oh, thanks.
Yeah.
Yeah, so how to help overcome the problem. So there's not going to be one problem that your patient or patients experience. Each is going to come across different problems at different times whilst you're working with them. And I think the key thing is having an open mind and appreciating, going back to something Pete said earlier about different learning styles. So, you've tried communicating something to the patient this way and it hasn't registered. So you then need to try a different way, and don't take it, don't think the patient's deliberately trying to ignore what you're saying or go against it. It's their processing, the way they process information will have been affected by the pain they've been in. So they won't necessarily respond in the same way to you in the same way that they did before they had pain. So just take time to sit down and explain it.
Mm,
And something that I've started doing with people that I'm working with is ask them to repeat back to me what they're going to do,
mm,
because I've explained it, they've said yes, but they might just feel under pressure to say yes, and they haven't really got it. So ask them to explain back to you what they're going to be doing, and then if it's not quite right, you can have a polite conversation and just slightly correct them. Yeah, also get them to write things down or print something out for them, because our memories are like sieves when the pain's really bad. What about
yeah.
you, Keith?
Yeah, I'll just take one big step back and get on my soapbox. And I think the most important thing is just as you said, Dave, they have to be willing to have a conversation with people. So instead of, in talking to, you need to talk with the person. And I realize healthcare systems, a lot of healthcare providers are constrained by the system that they work in. They don't have the time that they need. So we'll just park that and say that needs to be fixed. But in the time that they have conversations with people, listen to them, ask them what's important to them. Don't judge, but be open to what it is that they're seeking. And then, as you guys have both said, then they can find ways to help them get back to things that are important to them. Like you said earlier, Dave, people who are in pain often stop doing the things that bring them the most meaning because they're afraid it's going to cause more pain or hurt themselves. And that just creates a spiral going down and down. So if you understand that the most important thing to Dave is to be able to go for his morning walks and you haven't done them for a year because you're afraid you're going to do it, you need to understand that and then be able to help, get that person moving in that way again. You're not going to throw them in the deep end and say, well, start walking 5 kilometers and damn the pain. If you can walk 100 meters, it's great. And then maybe 2 weeks later, you can do 150 meters or whatever. But you have to connect with the person as a human being. And all too often, we don't see that happen. They're just sort of looking at the person and saying, well, here are your symptoms and what do you want me to do? And they just want help. They want somebody to understand, have a little compassion and empathy, and then have the knowledge to be able to help them to start to help themselves. That is the true supported self-management, working with their healthcare team to help themselves.
Yeah, thanks, Keith. The challenge is that from the emails I get is people actually being able to access pain self-management programs. Like, I mean, I think if us three, if we thought about how many other people do we know who are doing what we're doing, like pain self-management coaching and stuff like that, we might struggle to count more than it.
Mm-hmm.
It may not be more than 10, like, and we're talking sort of in a global fashion here, so there aren't, I mean, I'm not saying there's no one around, but getting on a program, seeing a coach, seeing healthcare professionals who are trained in pain self-management, they're as the old saying, the rare as hen's teeth, like,
Mm-hmm.
and I remember I had to wait 18 months to get my pain management program, so they're not, it has improved, but it hasn't. There's still a bit of a struggle really to get on there. So that's all right with the barrier, one of the barriers. But the second bit of the question here, how can we tailor pain management programs to meet the needs of the individual patients? I think we still, in the pain management world, we still struggle to meet the needs of people from different cultural backgrounds, like, and I was working with a GP recently up in Bradford, same. Really, really, really nice GP. He gets it, like, and how he adopted pain management for his patients. In Bradford, there's quite a big Asian population, and I posted something out on social media about people using faith as well to manage their pain, etc. And he picked it up, and he messaged me to say that he's been doing some work around that, with his patients in that area. And so it's about that. It's about this is the thing about being a coach. Really, it's that having this awareness is that not everybody, there are people who come from different. Hey, listen, when I worked on the expert patients program, we were told to go and work in the community, and there wasn't like, no, you can't do that. It was everyone, So we worked in we did people from from different backgrounds, etc., different cultures. We were working in delivering courses in a prisons, travellers, Asian, Chinese. It was everyone. There wasn't anybody who said no, we can't go there, etc. So it's about, and it's about adapting as well. We had to adapt some of the courses for people with hearing impairments or visual impairments, like reading the materials, etc. Like, so it's having that awareness, etc. So, but I think sometimes, we medical profession or in the, not just saying, just I think it's sort of every. I think they sometimes think where everybody can read, everybody can see, and what's not, stuff like that. I'm not sure if they're really geared up. They could be geared up better than they are now for dealing with different people from their community, like, So anyway, I hope that's
Just want to add to that, I mean, I think, and would this be wonderful? You talk about the GP, your general practitioner, or your family physician. They are the cornerstone of medicine. It's usually the
yeah,
first person often that you drop into to see.
yeah,
And if they understood this, even if they have to refer you out, or they have to refer you to the program, they could be that first stop where they
yeah,
understand what you're doing and say, well, in the interim, let's work together on some of these things. Because if they can understand what they need, because right now they don't know what to do, and they're like, I got to refer you out. I want you out of here because I don't know what to do. So
yeah,
we train them and educate
yeah,
them. They can at least say to somebody, here are some things that we can do. I would love to see more of that.
yeah.
Mhm.
And mate, I think it's going to be our last one. This is right up your street. This is, Keith. Because I know
Oh
you
boy.
like this. No, yeah, honestly,
No pressure, Keith. We're just
Yeah,
expecting the
okay, all
world's
right.
best answer here, so take
I'm
it.
sweating. I'm sweating.
this, This is your right up street. Emerging research.
Mm,
Are there recent studies or findings that support new approaches to pain self-management? No, so are there recent studies or findings that support new approaches to pain self-management? And the second half of the question is, how do we stay updated on the latest research related to pain management and self-care strategies?
that's a really good question. So I certainly don't know all the research out there because there's so much academic research. But in my experience, there still isn't of um, a lot of research on pain supported self-management or supported self-management. I've read a few articles, but really nothing recently. And again, I think it's still because it's not fully understood. And a lot of academic research is still focused in on a lot of the there are aspects, they're talking about the psychological and the emotional, but nothing that's really sort of pulled it back and looked at it from the self-management perspective. And the articles that I have read have been pretty good, but it's not an area where a lot of researchers have jumped into. One of
Mm,
the things that I've learned in my work in academic research is a lot of researchers, because that kind of research is what we call qualitative, right? It's not quantitative. So it's not numbers, ones and zeros. You can't measure it. You can't like 1 + 1 is 2. It's about people's feelings and emotions and their reports back. And for a lot of researchers, they don't really know how to deal with that. And so they shy away from it.
mm,
So until we start seeing more researchers move towards a qualitative research style, which is happening,
mm,
I think we'll start to see more of that research happen.
yeah.
But my experience, there isn't a lot out there right
I know our good friend Jo Belton over there in Denver, she's working with some people where to encourage more patient engagement,
now.
involving people like us
Mhm.
in their research, etc. I don't know how I see things that crop up on
Mhm.
LinkedIn which he's involved in,
Yeah, yeah,
and I've been involved in a few researchy stuff myself, like, but I think I may have I didn't really understand what was going on, um, and
What?
I did. There's I always ask if there's a layperson's version, because they punt this stuff out, and I try and read it, and it's too complicated for me. But there are. I remember someone on LinkedIn that actually posted something out a couple of months ago, and it looked really good. And I said, Is there like a layperson's version?" She said, "No, but I'll do one for you."
Mhm.
And it came back, and I thought what she was doing with the research, etc. Now I get that, I really
Right.
understood it. I thought, what a fantastic piece of work this is.
It's nice of her
The
to write it up in a simpler term. It's just a shame
Yeah,
they don't do that abstract for the
yeah,
lay person at the same time they do it for the
yeah.
medical professional.
I, I was talking to a researcher the other night when I was on a British Pain Society webinar, and I asked this question, is there to do like a noddy guide, like a simple version?
Mhm.
She said that researchers now are now doing that, it's a matter of it becomes the norm sort of thing. I mean, I'll tell you what I found back in the day, and it's got to be 20 years ago. There was an Australian researcher, painter, lady called Debbie Craylick in Australia, and I just come across it just by pure chance. And I think she was a nurse, and but I could understand every word because she was talking about self-management, etc., and self-care, and I um and I found it really. I tell you what, it inspired me to want to learn more. But
Mhm.
when I've tried to read research papers, they're right well out of my remit. I haven't got the academic uh, knowledge really to understand what the hell's going on.
Yeah, it's so I'm currently involved in a few projects, both in Canada and the US. Um and what I'm finding is, and there's no reason why that can't happen. The focus for a lot of these researchers is to be able to get it into sort of the mainstream academics so then it can make it to healthcare providers to make a change. The first step they have to do is get it so it lands with the academics. And so they write it that way so they can understand it. So they'll pick it up and carry it forward. And I get that because they need to speak in their language, but they could also provide these sort of other versions for people to read where it's much simpler. So I'm starting to see a bit of a change happen, but I still think it's going to be a few years out before. I mean, I'm glad to hear what you've encountered, Pete, where they're saying they're starting to do that more because that's really what needs to happen.
I think the last bit I had to stay updated. I'll tell you what I'm finding. What would be the best way for them to stay updated, Keith? I mean, I think LinkedIn seems to be probably the best platform, really. Would you agree?
I would say, I mean, that's the thing when you're looking at sort of the academic research. I mean, unless, people like you and me are subscribed to a whole bunch of open access journals, which I don't think we are, in the world of social media, probably LinkedIn is the one that's the most viable, and it hasn't become like other social media platforms where it's painful to read stuff. So, and yeah, I mean that's the thing. It's not really easily accessible for people, and that's part of the problem.
Okay. Well, thanks everybody for watching. Thanks for coming to our Q&A session. We've come to an end now, and we'll do another one soon. And you can get the link going via the website. We'll give you the dedicated link for the actual Q&A session. So thanks everybody for joining, and we'll stop the recording now. Take care. See you again soon.
Cheers all.
Thanks, everyone.